Hello my loves, welcome to the channel. If you are new here, welcome. It is Crissy G, and if you are back, welcome back. So I'm really excited to bring this video to you. I have so much that I want to talk about. There's a little bit that I want to speak on as far as mental health. There has been some concerns about mental health with medications like tirzepatide, which is now Mounjaro, and Zepbound. I want to talk a little bit about Zepbound. I'm sorry, I'm gonna have a hard time with this like I did in the beginning with tirzepatide. So there's a little bit of information out. As we all know by now, or most of us know by now, it has finally been approved. Mounjaro has been approved for weight loss in the form of Zepbound. So I do want to touch a little bit about that. I read on their website a lot of good information today, and so I want to share that with you guys. And I also want to just talk a little bit about how I've been doing on my second round of Mounjaro, because if you all have been following me, you know that I took about a 3-month break and then jumped back on it. And so now I've been on it officially this was my 4th shot today. And so I just kind of want to talk about what I've been experiencing and all that good stuff. So let's get started. First, I want to address the mental health issue, because I think this is something that we do not speak about very often. I had heard about it. I myself and the people around me have not experienced any mental health issues while taking these medications. There's not a whole lot of information. That being said, Zepbound, if you go and read all their side effects and things that could happen while on this medication, they did include mental health. And I think that's huge, because it was not on the side effects of Mounjaro. It was very vague. The symptoms, side effects, and all that good stuff was very vague. And so I'm very happy that they've added a lot of the things that many of us have been complaining about while on our journey. So I want to talk about all that in this video. But I am going to start with the mental health issue, because I want to end it on a positive note, as I do all the time. And I think mental health kind of is a draining conversation. And so I do want to go over that for a little bit. So I will say that I received an email from one of my subscribers, and I'm going to keep their name confidential. I did ask if I could share their story with you guys, and they agreed that it was okay to share their story. So in the email, so they wanted to let me know what had happened to them recently. And so they're saying that Mounjaro really messed them up, that they ended up at a psych hospital. They tried to hurt themselves. And so this person had never had any past history with mental health issues and had only been on Mounjaro and regular insulin. This happened over the course of a few months, and it gradually got worse, and then they admitted themselves to the hospital. So they're saying that they thought of me while they were in the hospital, and just how I speak on a lot of the symptoms and the things that happen while we're on these medications. And so immediately thought that they needed to put this into an email for me and inform me of their situation in particular, because they want it known and they want people to know. Because as you all know, on my channel, I'm no doctor, expert, or anything near the sorts, any kind of expert in anything really. I do share not only my experience, but people around me who don't mind sharing their experiences, because not everyone has the transparency or is willing to put themselves out there, because it does take a lot to receive all this feedback and criticism from people that don't always see eye to eye with your preferences or life situations, right? And so it took a lot on their behalf to share this with me, and I greatly appreciate that they felt comfortable enough to come to me and let me know that they had experienced this. They wanted to express what they went through and their concerns to the Mounjaro community, and they know that we have a really good platform here in community where we can share this information. So that being said, they do say that the doctor looked into Mounjaro, and that they recently found out in clinical research studies that hadn't been forthcoming at all about risks and side effects truly associated with the medication. So they requested more info directly from the FOIA, the FDA. And so they're saying that they are finding that these medications can cause mental illness. So that being said, you guys, I did go on to the Zepbound. So if you guys go to zepbound.lily.com, you can see all this information for yourselves. But I will say that something that stood out to me was the mental health issue, which, as I said, was not part of the Mounjaro side effects. If you go to prescribing information, it will pull up all the details about Zepbound. But what stood out to me was that they're including warnings and precautions on here, and it's very lengthy. One of them, as I said, also it gives you the entire breakdown. So I would highly recommend, if you're considering this medication for weight loss, that you go and read all the risks and side effects and all that good stuff. Because I feel like they're being a little bit more forthcoming with the weight loss medication versus the type 2 diabetes version of it. So it does have in here suicidal behavior and ideation. So I may be pronouncing that wrong, I don't know. Suicidal behavior and ideation have been reported in clinical trials with other chronic weight management products. Monitor patients treated with Zepbound for the emergence of worsening of depression, suicidal thoughts or behaviors, and or unusual changes in mood or behavior. So discontinue Zepbound in patients who experience suicidal thoughts or behaviors. Avoid Zepbound in patients with a history of suicidal attempts and ideation. So I want to say that that person in particular that wrote me said that they had never experienced. This is kind of making it sound like if you have had or depression or suicidal thoughts, then this medication can kind of bring out the worst in that, right? It can make it worse. And so the person that wrote me particularly personally said that they had never had issues with any kind of mental illness or depression. And so that's what was significant to that person, that they felt like I had never had these issues, and all of a sudden I got so severe that I ended up having to, admit themselves to the hospital because of the fear of having suicidal thoughts. And so that's huge, right? Because if you have anyone around you that is on this medication, or you personally yourself have, hadn't realized, sometimes we don't realize that these symptoms are because of these medications until someone else says it. So if you or anyone, any loved ones or friends or family that are on this medication, if you've noticed, that they're alienating themselves, maybe just being a little bit more quiet, just not sharing as much, you notice a difference in their personality, make sure you reach out, talk to them. If you are experiencing this yourself, make sure that you talk to someone about it. Maybe let your doctor know, because again, I want to say sometimes people don't believe people, right? Doctors are like, no, you're just, stop Googling or whatever it may be, but this is really serious. And so if you can do something to help someone, then make sure that you're alert about these side effects and symptoms that can potentially happen with these medications. So that being said, I personally have not experienced it. I don't know anyone around me. If anything, I feel like for a lot of people, because their body is changing, they're losing the weight, they're feeling more confident, like in my case, then you see this in a different light, right? I'm happier, I'm more confident in myself, and so things have, I'm more social now. I want to do things. I'm not just at home wanting to spend my weekends, in my four walls, because I want to be out. I want to have fun. I'm confident in myself now, finally, and so I'm more sociable. For not everyone may be experiencing that same feeling, or people who have extreme weight loss can also feel depressed because you've got the loose skin, and I've managed. My thighs, my upper thighs are horrible, cellulite, because my skin is so loose now. But I'm at the point where I don't care. That's not as important as now I'm healthier, now I'm feeling better about myself and all that good stuff. So it's a different journey for everyone, so just make sure you're alert about those things. Was surprised that they mentioned in here, because as you all know, we've experienced things. I was on Mounjaro for over on these weight loss injections for over a year, and so we all know that we've experienced the hair loss, we've experienced the loose skin, the Ozempic face, which is the gaunt looking face. We've experienced Ozempic butt, which many of y'all have complained that you've lost all your assets. And so we've experienced those things, but it wasn't a part of the list of side effects or anything like that, right? They weren't talking about the hair loss. They weren't talking about the fact that people feel so cold. They weren't talking about stomach paralysis then. They just said, oh, it will cause slowing digestive, and it could cause some digestive issues, but they weren't pinpointing things like stomach paralysis. But now that the masses are taking it, and so now you have more cases coming to light, now they're speaking on this. So I thought it was neat that they are including a little bit more of these side effects in here. And so I'll read to you guys some of the things that they mentioned in here. The risk of thyroid C-cell tumors, which we knew this with Mounjaro, when Mounjaro came out, that there is a risk of thyroid tumors. Now, they did mention, as they do here, that usually it's a pre-existing cases or people who have a family history of these particular tumors. And so that is still in here. Severe gastrointestinal disease. So Zepbound has been associated with gastrointestinal adverse reactions, sometimes severe. So in clinical trials, severe gastrointestinal adverse reactions were reported more frequently among patients receiving Zepbound. Zepbound has not been studied in patients with severe gastrointestinal diseases, including gastroparesis, which is the paralysis, right? Therefore, not recommended in these patients. Acute kidney injury. So use of Zepbound has been associated with acute kidney injury, which can result from dehydration due to gastrointestinal adverse reactions, including nausea, vomiting, diarrhea. In patients treated with GLP-1 receptor agonist, there have been post-marketing reports of acute kidney injury and worsening of chronic renal failure, which may sometimes require hemodialysis. So that's that. Acute gallbladder disease. I think that's a huge one also, because today in particular, I've been experiencing that pain that I get when I have a gallbladder attack. It's not severe or anything, but it's a very uncomfortable tightening feeling right underneath my diaphragm, or like my esophagus, I guess. It's always that same pain that I get when my gallbladder starts to act up. And so that's concerning. And I know many of you have gone in for gallbladder surgery while on these medications, which makes you feel like, is it making our gallbladders hypersensitive to where, many of us are having to get them removed? And so that is in here. It says in clinical trials, I won't even try to pronounce that, but I will leave it here for you. That way you guys can see. And also I will leave the link to the website that has all this information. But acute pancreatitis, which we knew with Mounjaro that there was acute pancreatitis. So anyone that has had issues with their pancreas or anything like that will not be a good candidate for this medication. Hypersensitivity reaction, which I don't remember seeing this with Mounjaro, but I could be wrong. So that's like anaphylaxis, and angioedema. Things of that nature. Hypoglycemia, so that's when your blood sugar drops, if I'm not mistaken. So that's also a factor here. Diabetic retinopathy complications with patients that have type 2 diabetes. The suicidal behavior. So adverse reactions. The following serious adverse reactions are described below or elsewhere in prescribing information. So that basically lists everything that we just kind of went over. It says that nausea, diarrhea, vomiting, constipation, abdominal pain, fatigue. Fatigue is also something that they had not talked about in Mounjaro. And a lot of you complain about feeling tired. I myself, the first, I think, 3 months on these GLP medications, I was so extremely tired. I mean, falling asleep at the wheel tired. That's how fatigued I was. So that is in here now. Hair loss, flatulence, dizziness. So I had been experiencing some dizzy spells and I didn't know. I just thought maybe I didn't eat enough, or maybe I ate too much or too fast, or my blood, I don't know. It hasn't happened often, but it's happened 3 or 4 times. Didn't think anything of it. Did not think it had any correlation between me and the medication. But now with Zepbound, it's in there. And remember, Mounjaro Mounjaro and Zepbound have the exact same active ingredient and the same dosages, so it's the same medication, but this has a little bit more literature than Mounjaro did. And I don't know if it's because Mounjaro came out much sooner and they just didn't have all the side effects, or maybe they've studied people who are, you know, sharing their journeys, and I don't know, or if they're literally just going based off of their studies. But this is a lot of the things that we talk about that were not in this literature before. So includes diarrhea, frequent bowel movements, includes constipation, feces hard, includes abdominal discomfort, abdominal pain lower, pain upper, abdominal tenderness, has injection site bruising, fatigue, blood pressure decreased. So there's a whole lot more in here that they're sharing that they did not necessarily share with Mounjaro. There is so much you guys can read about on here. I mean, it just goes on and on. I'm glad that they're being a little bit more transparent. Obviously, I don't think that they're going to be 100% transparent. I wanted to share the coupon information, so we're going to talk about the coupon information. I know a lot of you are saying there's a coupon out. The coupon is not out just yet, but it is in the works, I would assume, because they do mention it on their website. So if you visit the Zepbound website, there is, let's see here, there is an area here that you can find, and it says, let's see, you may pay as little as $25, and so for 1 or 3 months. So that is almost the exact verbiage they used when Mounjaro came out. So I didn't know in the beginning that if your doctor prescribed you 3 months, you could go pay $25 for 3 months worth of Mounjaro. Of course, that meant that you would be paying 3 months for the same dose, because it would be like the 0.5 for 3 months. Or so if you're not wanting to, if you're wanting to titrate every month, then that wouldn't be beneficial for you. But like myself, I ended up almost 3 months at each dose anyways. So that's going to be the same. Now, if you do notice, it says savings card coming soon. So it's not yet available, but it's coming soon, and I'm sure it'll be on the heels of the medication. I don't think it'll take them long to do that. Retail price for this medication with no insurance and no coupon is $1,060. So yes, it's a little bit more affordable than Wegovy, I believe, which is like $1,100 or $1,200 out of pocket. But the coupon will work if your insurance covers it. So if your insurance company says, yes, this medication is covered, and usually when the medication is so new, the insurance has no idea, and so they're not prepared. Just like with Mounjaro at the beginning, a lot of people were able to get Mounjaro through their insurance company and pay the $25, and then boom, the insurance company finally catches up with the medication and realizes, hey, no, this doesn't really cover, especially if you do not need it for type 2 diabetes. Then they would kick it off, and many people lost their $25 coupon and were having to pay either the full price out of pocket, or having to pay the $500, I believe, because it was covering a large portion if your insurance didn't cover the medication. So anyways, long story short, the coupon for the $25 will work if your insurance covers the medication. If your insurance does not cover the medication, you're going to pay about $500 a month, I believe is what it said. It was like 400 and some odd dollars, it said. Let's see if I can find it. It says save up to $563, so I think your portion would be like $480 or something like that. That's if your insurance does not cover it, but you do have insurance, then the coupon would just apply $563 towards the medication a month, which for me, that would not be attainable. So anyhow, if you guys want more detailed breakdown of the coupon, then let me know in the comments, and I will do another video specifically dedicated to information about the coupon. All right, so I did make an appointment with an old nurse practitioner that we've been seeing for a long time also. As you all know, I ended up with a virtual doctor here recently. I didn't go back to Dr. Z. I just, honestly, you guys, did not want to go back and I don't know. And we had a really good relationship and all that good stuff. I just didn't want to deal with the hassle of no, you don't need to be on this, which now Zepbound is approved for weight loss. So I don't see if it would be a problem, but I'm going to go to this nurse practitioner that I've been to for many years. My husband and I both see him, and so I made an appointment for us this week, this Monday coming. I'm really excited to see him. I'm going to let him know that I'm currently on Manjaro, but I want to try and move myself towards Zepbound. I have enough Manjaro to maybe make it until Zepbound puts out the coupon, but I'm gonna see what his thoughts are on it and if he's even heard about it or anything like that. And then if he prescribes me that and my insurance does not cover it, or will only cover a portion of it, and I'm still having to pay out of pocket a large sum, then I will probably ask him to rewrite the prescription with Manjaro. A lot of you have been asking me, how am I being prescribed Manjaro if I'm not diabetic? As we all have made clear, doctors can prescribe basically any medication off label regardless of what the medication is intended for. And so that's why I'm able to still get Manjaro prescribed, although I'm not type 2 diabetic. Now, my insurance company, it's United Healthcare, but my particular plan does cover Manjaro. So just because you have United Healthcare, it does not mean that it will also cover it, because there's a gazillion plans depending on your employer or just the plan that you're on. There's a gazillion different plans under United Healthcare, and some may cover it and some may not. It just depends on which plan you're on. Just like weight loss surgery, there's some insurance plans that cover weight loss surgery, and there's others that do not. My plan does not cover any type of weight loss surgery. So I just been fortunate that it does cover Manjaro, and my out-of-pocket after the insurance is applied is about $90 a month, which is way more affordable than if Zepbound is not covered and ends up being $500 a month. And so that's why I said, if I end up not being able to use the coupon, which I was fortunate enough to be able to use the coupon early on during Manjaro, so for a whole year I paid $25 a month, like most of us. And so if that's the case with Zepbound, then I will make the switch over, because obviously I'd rather pay $25 a month versus $90 a month. But if it's not covered and my insurance doesn't want to approve it, then my insurance wouldn't approve Wegovy. So that's why I do not have high hopes for Zepbound, because now the problem is that it's considered a weight loss medication. So if your insurance doesn't feel that a weight loss medication is necessary, then it won't approve it, right? You'll have to pay out of pocket. And so that was the problem with Wegovy. I was still going to have to pay almost $600 a month for Wegovy, because it was considered a weight loss medication and not a medically necessary medication. So there's that portion of it. But anyways, so on to my first, I'm started my 4th week of Manjaro today, and I have maintained my 5-pound weight loss that I did early on. I think the first week and a half on the medication, I dropped 5 pounds pretty quickly, and I've pretty much maintained there. I will say that I've not been as strict as I probably should be, but at least I'm maintaining, and I didn't gain any weight, because if you all have been following me, you know that I started steadily gaining a pound or two. I was gaining about 3 pounds a month, and so I went from 185 to 194, and now I'm back down to 189. I'm fluctuating between 189 and 190, and so that's kind of where I'm at now. As far as symptoms go, I'm back to having all the symptoms that I had the first go around, which is severe constipation, feeling cold all the time. I don't feel too tired. I had headaches the first week I was back on it. I've been experiencing really painful cycles, and I don't know if that ties in together with this medication. I went to go see my OBGYN recently, which is why I wasn't able to join Debbie on live this Monday. I know some of you have I missed you guys on Monday, and so we weren't able to record because I ended up going to go see my OBGYN, and I let her know that I have severe pain, especially on my left side. And I let her know that it's just to the point where it's unbearable. Sometimes it's hard for me to walk out of bed from the pain. I still do it. I still get myself out of bed. I take Advil and Tylenol literally every 4 hours just to manage the pain. But even then, right now, since I've been constipated and I'm gassy, but nothing comes out, it's just like a severe cramp. And I don't know, I did the ultrasound because I could swear, based on my Google findings, that I had some type of endometriosis or a cyst on my ovary or something, just because of the sheer, like, it feels like a stabbing pain. And I've not been stabbed, so I don't know what that feels like, but it's a piercing pain, just a sharp, it's not the dull achy pain that you normally would feel during a cycle. It's like a severe sharp piercing pain in my lower abdomen. I'm not greatly concerned because I only experience it during my cycle. So I'm like, maybe I'm just getting old and I just can't take the same type of pain that I used to take. But no, it's not that dull, achy, crampy feeling. And so I did get the ultrasound. They said the ultrasound looked okay. I did get my annual well women's exam, and they said everything came back okay. So I don't know, you guys, if you guys have experienced that and maybe I'm missing something, or I should ask for some other type of testing, please let me know in the comments, because it's pretty bad. And I'm like super bloated right now, and just if I sleep on my left side it hurts, if I sleep on my right side it hurts, and it's just, it'll go away when my cycle's over. I'll feel better. But for these 3 or 4 days, I'm in total misery. So there is that, you guys. So I just wanted to touch base with you all. Again, the weight loss is a little bit slower this go around, which makes it difficult, because especially if I'd have to be paying any more than the $90, it's just hard to feel like you're going to have to consistently pay this much for maintaining your weight, right? But I'm happy that I haven't gained any more. I was, going on a constant uphill with my weight. So I'm glad that we are managing that, and that now I'm staying in a more doable range. So I will put a little bit more effort into it, but it is the holidays, and it just makes it so much harder during the holidays to veer away from all those temptations. I will say that I meant to address a comment the other day, and I did do a video and everything. I just didn't get to post it. I did a shorts video. Someone let me know that, because I did put a shorts with telling you guys my frustration being off the medication and just the constant hunger that I was feeling. And they made a comment like, well, this is why you're supposed to learn how to eat and how to manage your weight while you're on the medication, so that when you're off of it, you're able to continue your good habits and maintain the weight loss. That is very true. You are 100 absolutely percent true to say this. But I will say that now, having experienced it myself on and off the medication, it's super easy when you're not starving, 60% of the day. It's easy to make good choices when you're not incredibly hungry, and any little thing that you eat will suffice and make you feel full. It's a lot easier to portion control when your body's telling you, okay, you had enough after a few bites. When you're off this medication and you go back to this ravenous hunger that you experienced before, that the food noise comes back. And what is food noise? Food noise is what's in your head because you feel hungry and you're constantly thinking about what your next meal is going to be, or what you want to eat, or what can I eat. And so you're constantly thinking about food, and it's hard because you're constantly feeling that hunger pain. People who don't experience hunger pain 24/7, or who don't experience much hunger pain at all, struggle to know what it feels like to be hungry all the time, and that makes you think about food. Because I will be honest, while I'm on this medication, I do not think about food 24/7 because I do not feel hungry 24/7. I don't think about food, so I really only sometimes eat because I know I need to eat something, or I eat a few bites and I'm full. And even though I didn't eat much throughout the day, I get full very quickly. So it's very easy to have good habits and maintain portion control while on these medications. But please be patient with everyone when they express that it's harder off the medication, because I will say, yes, it is very difficult once you come off these medications to keep your good habits. Now, on that note, I did see somebody on the news or doing an interview the other day, maybe it was here on YouTube, and they were talking about how people are going to gain all their weight back, and Ozempic is a scam. All these GLP medications are a scam, that, the weight loss comes back with a vengeance. You gain the weight back with a vengeance once you come off these medications. Yes, this is true if you choose to do nothing and go back to all your old habits. So I will say that I did learn a lot of good habits while on this medication, and I continue to do them. Again, it is hard though, and yes, the weight loss, I mean, the weight gain does come back, right? Because you have to keep with your portion control post these medications. So it's not a scam. It's not, it's also not a magic bullet. It's not a miracle pill, right? You still have to put the work into it. You still have to eat better. And even if you look on the Zepbound website, it says that this medication, along healthy eating habits and exercise, is what's going to cause the weight loss. So you cannot inject yourself with this medication and think that it's just going to magically melt your fat and you're going to be thin. That is not how this works. For some people like myself, I was able to cut down drastically on my portions. And although I kept a very big diet, I didn't reduce myself to eating salads every day. That is not a sustainable lifestyle. So yes, making good choices is a good thing. I would suggest making good choices 60% of the time, 80% if you can, and then goof off a 20, 30, 40% of the time. And by that I mean, like, if you know you have a special event or an anniversary dinner or a birthday, a party, whatever it may be, the holidays, you know, do good for most of the week, because you know you're going to indulge for someone's birthday or your birthday or anniversary or whatever it may be. And so that's what we've got to remember post medication, right? It's not easy. It's not easy. I will say it. Once you come off these medications, it is not easy. But at the same time, don't beat yourself up like I did. I did it for 3 months. I kept thinking, no, I need to be able to do this on my own. I preached about how you have to learn these habits so that you can maintain them. Yes, and I did keep a lot of the good habits. It's just that I started eating a little bit more because I was hungrier and I wasn't satisfied, and I wanted, you know, right now I can eat a very small portion and I'm good. It's easy for me to walk away. But when I was off of it for those few weeks, you know, I would eat the small portion and it's like, but I just want more. But I want more because I'm still hungry and I just want to feel full. I want to feel satisfied. And so that's the hard part. That's truly the hard part, because you can still eat healthy but overeat unhealthy foods. So really it all comes down to calories in, calories out, for me at least. And so yes, you guys, so I just wanted to kind of let you all know how I was doing and just talk a little bit about this new medication. I'm sure there's going to be so much more information flooding social media and all that good stuff. So I really highly recommend you all to go onto Eli Lilly's website and read about it yourself, because there's nothing better than you doing your research so that you can understand for yourself the information on these medications. And so as always though, I do not mind sharing with you all. So if there's anything that I missed or that you want me to talk about, please share it in the comments below, and you guys know that I will do my best to respond. Or our community here, everyone kind of helps each other out. I love that you all do that for one another. So thank you all for joining me today on this video. I hope you found it somewhat informative. Thank you so much. Until next time, talk soon.